In that healing, you talked about breath patterns, tension in abs, tensions in the pelvic floor. You talked about why that's important. And then could you share with docs why it's so important for docs to talk to their patients about this for postpartum? And I know that covers a lot.
Yeah.
Because you covered a lot of.
So we talked about pelvic health because if you look at the stats, you have 1 in 4 women who are older than 18 who have some sort of pelvic floor disorder, whether it's pain, urinary incontinence, or prolapse. And they're big numbers. Vaginal births, 50% of women will have some level of prolapse. You have, as you get older, you start looking at, and there's many more stats in this, but women over 65, there's 60% of them that have incontinence, 50% have prolapse. These are big issues that are affecting women. And it's just like a post I saw not long ago. It was like the obesity that started, or the obesity at 50 started in the 20s and 30s. The diabetes at 60 started in the 40s. So it's like these things started earlier. And if we can work on them now with many things in our health journey, we can make it so that as we're older, we are in a healthier body. And so I'm really focused on the pelvic floor because I work with pregnancy and postpartum, and I've been in that stage 4 times myself, is that if we can start working on this in these earlier days when people are in their 20s and 30s having babies predominantly, of course it can expand a little beyond that, then we can work on, can we change some lifestyle habits that make the prolapse and urinary incontinence worse? Can we add in the postpartum recovery? Because 35% of women get postpartum rehab, and it actually changes how their pelvic floor functions and how their symptoms are, and if they even resolve things like prolapse and urinary incontinence. But only 35% of women are getting this. So what I was talking about in the talk with pregnancy and postpartum is there's certain things that make it worse. So one of which was thoracic mobility. If we don't have mobility of our thoracic spine, now I have a lot of mobility, I'm hypermobile. If we don't, then our abs are gonna work harder. And if they're working harder, over time they're gonna have more tension. Because this is anytime you're reaching for something, if you're having to work harder to get to it. So as a chiropractor, we play a role in that. We can give them thoracic mobility.